Welcome to this lecture on next-generation Nclex case study questions. Today, we will be exploring a real-life scenario of a patient who was admitted to the hospital with a severe case of thrombocytopenia. We will be discussing the patient's history, nurse's notes, physician's order, and lab values to understand the process of blood transfusion and the primary goal of the treatment. By the end of this lecture, you will be able to understand the importance of patient identification, blood compatibility, transfusion of blood components, monitoring of vital signs, and laboratory values during blood transfusion. So let's begin by examining the patient's history and nurse's notes. Let's see the patient's history. John Doe, a 45-year-old male, was admitted to the hospital with a history of severe bleeding from an injury. He was diagnosed with a severe case of thrombocytopenia and was in need of immediate blood transfusion. To understand the scenario in depth, let's see what's written on the nurse's notes. Following this are written: assessed the patient's identification band and matched it with the name on the blood sample. Checked the RA and ABL compatibility of the blood sample before transfusing. Transfused 1 unit of packed red blood cells to increase the erythrocytes for oxygen transportation. Transfused 2 units of platelets to address the thrombocytopenia and improve clotting. Monitored the patient's vital signs during and after the transfusion. Checked the laboratory values for erythrocyte and platelet count after 4 to 6 hours of transfusion. To understand the scenario in depth, let's see Physician's Order tab 2. Following points are mentioned here. First, transfuse 1 unit of packed red blood cells. Transfuse 2 units of platelets. Check laboratory values for erythrocyte and platelet count after 4 to 6 hours. Monitor vital signs during and after transfusion. We need to see the lab values to understand the scenario better. Here, in the given scenario, we are given hemoglobin increased from 8 grams per dl to 9 grams per dl after transfusion. Hematocrit increased from 24% to 27% after transfusion. Platelet count increased from 50,000 to 150,000 after transfusion. Based on all these scenario, history, and lab values, we have the first question to solve for this case study question. What type of blood component is used in cases of thrombocytopenia? A. Packed red blood cells. B. Platelets. C. Fresh frozen plasma. D. Albumin. The answer is B, platelets. The reason is quite obvious. We use platelets in cases of thrombocytopenia. Based on the same case study, let's see the second question. What was the outcome of John Doe's blood transfusion in the hospital? A. Hemoglobin and hematocrit both decreased after the transfusion. B. Hemoglobin and hematocrit both increased after the transfusion. C. Hemoglobin decreased and hematocrit increased after the transfusion. D. Hemoglobin increased and hematocrit decreased after the transfusion. E. There was no change in hemoglobin and hematocrit after the transfusion. F. The transfusion was not successful and the patient's vital signs were not monitored. G. The transfusion was not successful and the blood sample was not checked for compatibility. Take your time to solve the question. Correct options for this question are options B. So what could be the explanation? Option B is correct as per the lab values. Hemoglobin increased from 8 gram per deciliter to 9 gram per deciliter, and hematocrit increased from 24% to 27% after the transfusion. Option F is incorrect as per the nurse's notes. The patient's vital signs were monitored during and after the transfusion. Option A, C, D, E, and G are incorrect as they are not supported by the patient's history and nurse's notes. Let's see another question based on same case study. Which of the following statements is not true about the patient's blood transfusion process? A. The nurse assessed the patient's identification band and matched it with the name on the blood sample. B. The R and ABO compatibility of the blood sample was not checked before transfusing. C. 2 units of platelets were transfused to address the thrombocytopenia. D. The vital signs were monitored during and after the transfusion. E. The laboratory values for erythrocyte and platelet count were not checked after 4 to 6 hours of transfusion. F. The physician's order included checking the laboratory values for erythrocyte and platelet count after 4 to 6 hours. G. The patient's hematocrit increased from 24% to 27% after transfusion. Take your time. The correct answer are B. The R and ABO compatibility of the blood sample was not checked before transfusing, and G. The patient's hematocrit increased from 24% to 27% after transfusion. Let's understand why the options are right or wrong. A. The nurse assessed the patient's identification band and matched it with the name on the blood sample, so this statement is true. B. The RH and ABO compatibility of the blood sample was checked before transfusing, so this statement is false. C. 2 units of platelets were transfused to address the thrombocytopenia, so this statement is true. D. The vital signs were monitored during and after the transfusion, so this statement is true. E. The laboratory values for erythrocyte and platelet count were checked after 4 to 6 hours of transfusion, so this statement is false. F. The physician's order included checking the laboratory values for erythrocyte and platelet count after 4 to 6 hours, so this statement is true. G. The patient's hematocrit increased from 24% to 27% after transfusion, so this statement is true. Let us see another question based on same case study. What was the primary goal of John Doe's blood transfusion according to the physician's order and nurse's notes? A. To increase the patient's hemoglobin and hematocrit levels. B. To improve the patient's oxygen transportation. C. To address the patient's thrombocytopenia and improve clotting. D. To monitor the patient's vital signs during and after the transfusion. The correct answer to this question is C, which says to address the patient's thrombocytopenia and improve clotting. Let's see why each of these options are either right or wrong. Option A is incorrect because while the hemoglobin and hematocrit levels did increase, that was a secondary effect of the transfusion. The primary goal was to address the thrombocytopenia. Option B is incorrect because while improving oxygen transportation was a result of the transfusion, it was not the primary goal. The primary goal was to address the thrombocytopenia. Option C is correct because the physician's order and nurse's notes indicate that the primary goal of the transfusion was to address the patient's thrombocytopenia and improve clotting, as evidenced by the transfusion of 2 units of platelets. Option D is incorrect because while monitoring vital signs was part of the process, it was not the primary goal of the transfusion. The primary goal was to address the thrombocytopenia. Next question. What was the purpose of the nurse's assessment and monitoring during the blood transfusion for John Doe? A. To increase the oxygen transportation. B. To improve the patient's clotting. C. To monitor the transfusion's effectiveness. D. To check the compatibility of the blood sample. The correct answer is to monitor the transfusion's effectiveness, or option C. Option A is incorrect because the purpose of transfusing packed red blood cells was to increase the erythrocytes for oxygen transportation, not the nurse's assessment and monitoring. Option B is incorrect because the purpose of transfusing platelets was to address the thrombocytopenia and improve clotting, not the nurse's assessment and monitoring. Option C is correct because the nurse's assessment and monitoring during the blood transfusion was to monitor the transfusion's effectiveness. The nurse checked the patient's vital signs and laboratory values for erythrocyte and platelet count after 4 to 6 hours of transfusion to ensure that the transfusion was having the desired effect. Option D is incorrect because the nurse checked the RH and ABL compatibility of the blood sample before transfusing, but this was not the purpose of the nurse's assessment and monitoring during the transfusion. We have finally reached the last question of this case study. What is the correct procedure for blood transfusion in John Doe, a 45-year-old male with severe thrombocytopenia? A. Transfuse 2 units of packed red blood cells and 1 unit of platelets. B. Transfuse 1 unit of packed red blood cells and 2 units of platelets. C. Transfuse 2 units of red blood cells and no platelets. D. Transfuse 1 unit of red blood cells and no platelets. The correct answer is B, or transfuse 1 unit of packed red blood cells and 2 units of platelets. What could be the explanation? For option A, transfusing 2 units of packed red blood cells would not address the thrombocytopenia and would not improve the patient's clotting. The patient's hematocrit only increased from 24% to 27% after transfusing 1 unit of packed red blood cells. B. This option is correct as per the physician's order, the nurse's notes, and the lab values after the transfusion. 1 unit of packed red blood cells was transfused to increase the erythrocytes for oxygen transportation, and 2 units of platelets were transfused to address the thrombocytopenia and improve clotting. The laboratory values showed an increase in hematocrit and platelet count after the transfusion. C. Transfusing 2 units of red blood cells without platelets would not address the thrombocytopenia and would not improve the patient's clotting. The patient was diagnosed with a severe case of thrombocytopenia and required platelets for improvement. D. Transfusing 1 unit of red blood cells without platelets would increase the erythrocytes for oxygen transportation, but would not address the thrombocytopenia and would not improve the patient's clotting. The patient was diagnosed with a severe case of thrombocytopenia and required platelets for improvement. In conclusion, John Doe's blood transfusion was a success with the primary goal of addressing his severe case of thrombocytopenia and improving his clotting abilities. The RA and ABO compatibility of the blood sample were checked before transfusing, and 2 units of platelets were transfused. The patient's vital signs were monitored during and after the transfusion, and laboratory values for erythrocyte and platelet count were checked after 4 to 6 hours. The results showed an increase in hemoglobin and hematocrit levels and an increase in platelet count. These are examples of next-generation Nclex case study questions, and they test the nursing knowledge and critical thinking skills in real-life scenarios. Next-generation Nclex questions include multiple response, prioritization, delegation, and leadership questions, and alternative format questions.